very slowly and gently, taking help of both the hands. Comfort. Second question. Do you feel comfortable? Really? You feel comfortable? Okay. So this way you can use. You want to do it on the other side, or you want to go for next?
Other side.
Because it's very relaxing. So here I will request some of you to get up and press on the lower back of a person. If he is lying down, use this one pressure here, one pressure here, or like this. Either I can do this way, put my body weight onto him, or I can do this way. When he is doing, your pressure is going, you are leaning. This starting of and leaning. Stop second last. Okay. Try this. Few of you. So you should go for it. Try another side.
Okay.
One more variation I'll teach. Rather than doing the same, we'll do this. This technique is called as sitting like this. Is called as a girl of India, ancient India, was waiting for her husband at the bank of a lake. And she developed a severe headache, neck pain, back pain, and all those things. When she sits like this, then she feels comfortable on half side. When she sits like this, she is comfortable on both the sides. Because you are putting head weight onto the hands, weight is transmitted to the elbow, neck muscles are free. You see this? This is called as Shakuntala Asana. Shakuntala listened to the story. Shakuntala.
Anyone knows the story of Shakuntala?
No. So,
He doesn't. We don't know what he's saying.
like this. Take a deep breath in.
Think he knows.
For headache, I use this technique also. Neck pain, I also use this technique. Continue. Breathing in. Two more times. Breathing in. Feel the changes happening around your muscles. Slowly. Not much, but at least little bit improved feeling. Somebody having? So rest of the things, you can check it on YouTube later. Because I'm recording and I'll upload. Because 2-3 variations were already in different classes. In the other classes, there was 3 to 4 hours given to me, so it was detailed. So I can see it later. Next I'll go for one asana called as Advasana. It is one of the perfect spine stretching posture. Anybody is having back pain now and right now? Yeah. So what we'll do is asana, what you just lie down. Asana is, as I said, yes. You are stretching your upper body up, lower body down. This is called as Advasana, this posture. So stretch like this and bring it back. So exactly it works at the level of the spine. So here I use two people to give resistance. There is the asana name, but here I am using medically little change as a So pull at once together. 1, 2, 3. Stretch. One moment. Gentle. Pull. 1, 2, 3. 1, 2, 3, 4, 5. Release. How do you feel? Good. 1, 2, 3, 4, 5. One more time. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Slowly release. Go back.
Thank you.
Same way, somebody is lying down. If you are just one person, make his lower body just there and lift, put it here. Again lift, put it at the center. Lift, put it at the right. So one set of exercise slowly. You are only moving upper side of the back. And ask him to keep it upper body constant. Then lift the leg, put it here. Wait for a few seconds. Again take it up, put it here. Few seconds, then take it here. Easy. Like this, many techniques can be designed. Thank you.
You should talk to them about how many asanas we have and how they need to use all this knowledge in their regular practice. They're not the teachers, they don't want, most of them they're not because of the teaching side, they want to improve their practice, how they can take this to their practice.
Hold this basic concept at the back. I have all the joints, 205, 206, 650 muscles. Based on the areas of involvement, you can design technique, range of movements, up and down, right and left, rotation, change direction, without having any knowledge of asanas. And if at all we are doing some asanas, say for example I am stretching sideways and then slowly stretch. So there is a lateral stretch of the spine. Again, come back. There is also neck movement, shoulder movement. So there will be simultaneous movements of few of the groups of muscles, and each set of muscles are having different actions. Some is just a stretch, some is a flexion, some is a muscle isotonic, some is isometric. So it's a permutation combination of this. So imagine I have not told much asanas, nothing almost, but still there is a concept behind it, and based on that concept you can design your own techniques. In this 1.5 hours shortest possible time, this is the best you can club. So that's why I could record some of them. So there is one more of 4 to 5 hours of spine, neck and back exercises. Actually, I'll send it to you or send it to Ganesh where you can forward to you. Any questions?
The very last general question. What do you think about alignment? Should you care about alignment, or in the beginning should you just let them move?
Let the body moves. See, usually I teach is a medical yoga where I don't want my patient to be scared in the beginning. Breathing in, hands raise. Breathing out, hands down. He'll be confused. Shall I breathing in, hands down or raise? When I go back home, I'll say go with the flow. Initially, focus on the muscles. Let the breathing takes care of its own breathing. And slowly, simple range of movements, increase it to some degree, maybe 5 days of regular simple movement, where he'll be able to coordinate. Then you can change some exercises like this. Interlock your hands, breathing in, stretch your hands, breathing out, exhale, come back, relax, something like this. So you are making slowly to coordinate his body movements and the breathing. Then maybe next, the 145-degree angle, and slowly bringing it back, maybe some 10 times.
But regarding the asanas, so for example, trikonasana. Yeah.
It's okay. Triangle.
So yes, triangle pose. So everybody is able to do a triangle pose, almost, yes, but not in the right way. So everybody can move, but should I ask them to bring them back up in the right position to keep your hips parallel and blah blah blah? Shoulders open.
Depends on what the students is coming for. In the paper I have given, the paper if you read, there is another one. Usually what I mention is, what is the purpose of you coming for asanas, coming for exercises? I want to reduce my back pain. Then I will not teach anything about alignment or anything, absolutely no. I will make them just relieve their back pain. Immediate step is that. First few days I will only concentrate on relieving their back pain. I know the method, I don't exactly want them to know at the right beginning stage. Then slowly make them coordinate the breathing and work up, then the correction part. First, on the first day I don't do corrections. I will not even ask them for.
No, not on the first day, yes. But I also think when you don't give them the right alignment, you don't focus on the right muscles.
True. I completely agree with you. But you do it in a coordination or midway, not extremes. Okay, just
no, not as short. Don't not, but
not like teaching a TTC program, teacher training program, not like that. If it is not like that, then no problem.
No, but a lot of clients are very motivated and they want to reach the floor, so they are trying to reach the floor.
Yeah.
But they look totally unbalanced. Yeah.
So in that way, definitely, it is your judgment where you use a discrimination to correct and use it. If it is more, not recommended in initial days. If it is bit of pelvic correction and tuck the pelvis in and all those, that can be done. It's easy. So it's.
I think that these techniques work for any kind of pain, whether it's muscle pain or you feel like it's different.
It is a technique for including all the tendons, ligaments, bursa, there is some other tissue called bursa, and fascia and muscles. This is technique for, it includes all.
So I have
Myofascial release. Yeah.
this shoulder that clicks and there's no pain, but it clicks and it feels odd.
Yeah.
With this,
I do have.
You have that too?
I do have in left hand. It means that the fluid we call synovial fluid is bit less and it is giving a space for the joint to rub and make a sound.
Okay.
So idea is to increase the synovial fluid. So increase structure of a collagen content of your foot more collagen content of the foot, more alkaline diet, and more diet which can strengthen that, increase the bulk of the muscles, more proteins. And then simple range of movements, no strenuous exercises, just simple range of movements. Or if at all you use weight, use a small weight, so for example 2.5 kg, and do multiple times, maybe 100 times. So we are working on the very subtle small groups of muscles around that particular joint structure and stimulating the secreting of the fluid. This is what we are focusing on. If I use big muscle, big to weight, it is focusing on outside rotator cuff muscles. So if I am using small muscles, a small weight and multiple times, it is focusing on small groups of muscles and the deeper part of the joints. This we can repeat. And you can use warm, hot and cold therapy. You use a hot water towel, dip it in hot water, apply it on the shoulder, wait for 3 minutes, take it out, take ice freeze, cold water, put it on the shoulder. So you are altering the blood circulation very fast. So body gets confused. So it says, okay, let me send some repair mechanism chemicals there. So it will start repair. It helps. So you can use multiple ways.
Thank you.
So the best thing for neck pain is the exercises you did in the beginning,
Okay.
like,
Yeah.
okay.
So it's very little we talk. So neck is this. Simple, even in this it had range of movements. Right and left. Tilt. This. There is a mudra called as Mayura Asana. Mayura mudra. So pull your neck muscles like this. Wait for 10 seconds. Bring it back. I'll use combinations. Pull your neck muscles in front. Wait for 5 seconds. Bring it back 10 times. So for neck, another one we use is quickly alternate fast. Same range of movements. Right. Up and down. Right and left. Tangential. Tangential. Clockwise. Clockwise and clockwise. I use my head itself towards the gravity to focus on the neck muscles. This is also very good for headache and upper shoulder pain. Hold like this. Put your this part of the head here and move. As much as possible, as slow as possible. So you're using the floor to massage your head. Left, right, left, right 10 times. Like this. Left upper corner, right lower corner. 10 times. Then this way. Right upper corner, left lower corner, approximately. Then rotation, down, left, up, right, down. Change direction, down, right, up, left, down. Then followed by, make them do this. 10 times. Followed by stretch. Like this. To be like this. This is swan posture. Stretch like this. Then I may pull or push or adjust with the fingers here at the back. Then this. If you still have time, I can teach you one more and send you. Still have time? Okay. It is very interesting. I am boosting my shoulders here. One hand I am giving to him. Either way. Shoulder melody. So I want to work on interscapular muscles. This is a Russian secret sports exercise. Release. Release ಮಾಡಿದ್ರೆ ಪೂರ್ತಿ ಕೆಳಗೆ ಬಂದು ಕೂತು ನೀವು ಮಕ್ಕಳು ಈಗ ಸ್ಟ್ರೆಚ್ ಜಾಸ್ತಿ ಮಾಡಿ ಹೇಳ್ಕೊಳ್ಳಿ ಹೇಳ್ಕೊಂಡು 1, 2, 3, 4, 5. So this is very interesting on both the sides. It will loosen.
In opposite side.
Yes, balance.
ತಲೆಗೆ ತಿರುಗಬೇಕು ಇಲ್ಲ ತಲೆ ಒಂದೇ ಕಡೆ
ತಲೆ ಒಂದೇ ಕಡೆ ಇದ್ರೆ ಪರವಾಗಿಲ್ಲ.
ತಿರುಗಿದ್ರೆ ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ.
ತಿರುಗಿದ್ರೆ no. You can use it in a stylized way. I'm using my hand to put a pressure and shake hand and loosen the joint of somebody come. Shoulder pain somebody.
Sorry. Lens
Loosen the hand. Like this. Little bit up. You keep a focus on here. See here. I use this hand to pull with an idea that I'll all the way sit and make these muscles loose, and then I push. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I hold for long.
See, this is very good exercise for kids. What do you say?
They're right.
for after school. What do you think? You have to try that one.
So you do it for yourself rather than just looking. Do it for yourself and then you find out.
Okay.
Shake hand. Look. Going to bend down. Push. I don't know. Loose.
Okay, so.
Yeah, we should stay at the end. I did not finish, right?
You do this side?
Yes.
This is like a sword, so I'm hoping that it will. I should have actually did that one, so.
Okay. Next time.
Great, I do.
You will come.
Now I did it.
Does the finish? Yes.
Yeah.
So, is the finish ready to do this one?
I don't know. This side. Okay, so.
One more.
The other side.
Bending. That's all. You can pull. Yeah.
Okay.
Put one hand here. One.
So if I'm against you, yes, my. Okay.
Fine, hold. One. It's with the lock. Slowly release. Feel comfortable. See, your interest is very great.
Yeah.
All of your interest is very great. So that takes us beyond the time. So I have difficulty to run with the time. So one more. Snake walk. This might be new for yoga teachers also. For pelvic loosening exercise. I want to loosen and manipulate my pelvis by using a technique similar to walking of a snake, like this. 1, 2. If you imagine snake goes like this, so we have a feet, we are walking like a snake. Lower pelvis, absolutely beautiful effect. Even if somebody is having very severe, moderate or very mild pain, it is still working. Yeah. Pelvis is moving. Any questions? Otherwise, we wind up the session. It is just nothing is completed. It just started. That's all. I never take it as any session ends. I'll not say usually. It begins. So I have not taught everything, but given an overview, idea and a clue and few exercises. With this help of few exercises, with this idea, you can design more. Any questions you can ask, otherwise one home to Shanghai.
Okay.
I have for someone really deep muscle pain in a hip. I always feel like I want to just pull it. That was a really good one.
Let me think some exercise for it. Hip joint, is it?
I don't know if it's in. I don't know if it's in the joint. It feels like it's really deep down. You know?
Okay. Shall we design one quick technique for it? Same posture of a hip extension and flexion. I extend my hip and I flex. I will ask you to do like this. Come here. Let me see if it works or not. I am not sure, but still let me try. I want to put a pressure like this on your leg, and you are going to go down, and I'll put pressure here, and you are going to come up. Let's see. I'll use two techniques. Lay down straight like this. Straight.
On the floor.
On the
Face
floor.
down.
Supine. Okay, you want to lay down? This way? No problem.
Sorry?
You
Other way. So wait, when we did that exercise over there and you had to push your legs out.
Let's raise totally. See, my focus here is I am thinking of the joint. I am thinking of the hip joint, and I am thinking of the gravitational force. By using this, I am putting more force onto the hip joint. Now I put this. You move your ankles up and down.
My feet.
My feet up. Slowly, slowly. Down. Where is the pain you're feeling?
No pain.
Pressure. Pressure on your hip joint.
Push it.
Pressure on your hip joint.
No, it's fine. Sorry.
More resistance.
No.
So up and down movement. When you go back, you're going to push. It's this way. Push. Up. Push. Backwards. Yes. Up. Slowly. Very fast. Push.